because right now we will have the first keynote speech of today's event. We will present the key findings of the European Paediatric Innovation Ecosystem research by van der Broek from Inveniam Group.
Good morning, everyone. Picture a world where children's health flourishes through innovation. In our presentation today, we delve into unlocking the potential of pediatric progress. Beyond all the advancements, there are still many barriers to be overcome. We aim to unravel this intricate web of challenges that stifle progress in pediatric innovation, hoping to create a new network and a new spark that can propel us beyond these barriers for a healthier and brighter future for our youngest generation. There are 2.4 billion children worldwide, comprising 27% of the global population. This uniform population conceals diversity, stemming from age differences and the presence of over 7,000 rare pediatric diseases. In the face of such diversity, there's a crucial demand for pediatric-specific innovations capable of meeting the needs of each child. However, pediatric healthcare grapples with slow progress and limited innovation, attributed to several critical factors. Merely 9.4% of total funding supports pediatric research, and a mere 1.6% of overall venture capital in healthcare is focused on pediatric initiatives. Challenges further persist further down the line, with limited access to cutting-edge pediatric innovations affecting 22% of healthcare professionals, who say that they have access to the latest medical advancements. Further complexity arises from developmental challenges and the scarcity of a unified network amongst specialized children's hospitals. Compounding these issues is the fragmented pediatric landscape, which hampers collaboration amongst key stakeholders. This hinders the identification and leveraging of key opportunities. Such a disconnect obstructs the formation of effective initiatives, frameworks, and policies, leaving a large untapped reservoir of innovation, and especially in emerging and moderate innovation groups. So as we've already heard a little bit today, the i4Kids Europe initiative, funded by the European Commission, aims to foster synergies and bridge gaps between diverse pediatric stakeholders and territories. A pivotal initial phase of this was to understand deeply the different barriers and needs that all stakeholders face, both from the different types of innovation actors and also the types of innovation regions. And this is what our first action focused on. So our methodology was twofold. So we had spread a questionnaire we had it open for several months. We collected semi-quantitative data and draw insights from 148 responses, and we similarly conducted 25 stakeholder interviews. Using both Likert scale assessments and ranking questions, we systematically evaluated the importance of 8 distinct barriers. Following the European Innovation Scoreboard ranking, which is not pediatric specific but focused on innovation, we classified respondents into 4 innovation levels. Concurrently, respondents were classified into 7 diverse stakeholder groups, and this established a dual layer analysis. Our exploration then took us into the intricacies of 8 barriers, such as shown on the screen. So we have commercial and adoption, financial, regulatory reimbursement, cultural and incentive, human capital, and let's name them. So what were the results? So after we cleaned all the data, we were left with 148 good responses that paint a broad picture of the pediatric European innovation ecosystem. So as we see, we have quite a diverse mix amongst the innovation groups, which was quite essential for us to identify what barriers differed between these groups. Moreover, we were able to get responses from all important innovation actors, but with a primary focus on research institutions, healthcare institutions, and SMEs and startups. So what were the key findings? So zooming out onto the broader ecosystem view, a broad consensus emerged on the key barriers impeding pediatric innovation across various innovation levels. So the key barriers that came to light include financial barriers, regulatory and reimbursement barriers, commercial and adoption barriers, and human capital barriers. These common challenges stood out as main obstacles amongst all respondents, consistently identified as primary constraints to pediatric innovation across the entire European landscape. However, examining different innovation groups revealed distinct challenges, reflecting the different needs of local pediatric innovation landscapes. For instance, emerging innovators prioritize regulatory and reimbursement barriers, while higher innovation groups focus more on financial hurdles. Notably, lower-level innovators consider human capital barriers as a far more significant challenge compared to higher-level innovators. And at the same time, cultural and incentive barriers matter less to these emerging innovation groups in contrast to their higher innovator counterparts who rank them more highly. So let's try to understand a little bit where these differences come from. The number one constraint to pediatric innovation is the financial barrier. This is quite unsurprising, I think, for most people. So it was listed as the most important barrier for SMEs and startups, research institutions, and healthcare providers alike. Notably, its prominence varies, being more important for stronger innovators and becoming less important for weaker counterparts. In our interviews, 89% of respondents emphasized the difficulty in securing financing for early-stage pediatric projects, encompassing both public and private funding sources. Looking at the different levels of innovation, only emerging innovators did not list financial barriers as the most important barrier. We can also see a difference between the importance of the financial barrier and the type of stakeholder. So what we see is that commercially minded stakeholders from lower innovation countries place less importance on the financial barriers than those with higher innovation areas. And this is almost like a counterintuitive finding. The reverse was seen for research institutions. So this led us to hypothesize that perhaps it's the research institutions that are driving innovation still in these emerging and moderate ecosystems rather than, let's say, more the private side. During the interviews, it became clear that the challenge in accessing pediatric innovation funding is dual: a lack of awareness about available grants, and insufficient knowledge, experience, and support for successful applications. This is evidenced in quotes from emerging innovators stating that pediatric innovation is simply not recognized as a great need within our country. And this is showing an issue from the top down. However, there is also an issue on the skill set and capabilities, saying that they know that these grants exist, but we have trouble obtaining access to them and securing this funding. So to overcome the financial barriers, we propose 3 key recommendations. The first is the introduction of training modules and workshops that can address knowledge gaps and enhance grant application skills. Second, we can advocate for pediatric-specific research and innovation calls, which can create dedicated funding channels. And obviously, we should organize networking events and establish successful case databases that can foster collaboration and validate the use of both public and private funding for pediatric innovations. These strategies aim to empower innovators, bridging gaps and fostering targeted support for pediatric initiatives. Regulatory and reimbursement challenges emerge as the primary barrier for large companies. The hurdle ranks second for SMEs and startups and research institutions, and third for healthcare providers and patient organizations. This suggests that commercial-oriented institutions value regulatory and reimbursement barriers more highly than the research-focused counterparts. This challenge is universally echoed across all innovation groups. Regionally, SMEs and research institutions in leading countries place higher importance on regulatory barriers than their counterparts in moderate and emerging regions. The opposite is true for investors, who perceive regulatory and reimbursement barriers as less critical in leading innovation areas, and more important, in lower innovation regions. A potential reason is that lower innovation region investors are less exposed to the mature companies that are facing regulatory and reimbursement barriers. Insights from interviews further underscore these challenges. They note that there's challenges with the new MDR and adapting it for pediatrics and different age categories, because as we know, the pediatric population is very diverse. Moreover, and what has also arisen from our discussions, is that there are limited centers in Europe, and these are not dedicated to children. So finding the right sites and the right patient groups, especially for rare diseases, is extremely difficult. And moreover, as we know, it's very hard to obtain good cost-effectiveness data, and this is further challenge for pediatric care. And there is an under-evaluation of pediatric data by the health technology assessment authorities. So what can we try to do? We propose several ideas. So that we can try to develop micro-sampling and micro-testing concepts to directly address concerns raised in the interviews about adapting to the new MDR and trying to work with different types of data and access to patients. Moreover, we can provide better guidelines for assessing quality and DALI impact, which offers a structured framework to help with the under-evaluation of pediatric data by HTAs. Moreover, proposing a certified startup label aligns better with the need to an easier route to market and helping, let's say, give credibility to startups that have good data and are credible but are hesitant to be adopted by the hospital systems. Additionally, advocating for a more DIGA-like reimbursement scheme provides a systematic approach to alleviate broader reimbursement challenges. So these are several of the actions we believe we can try to do to overcome some of the regulatory and reimbursement challenges. The third critical barrier was commercial and adoption barriers. And this is acknowledged by 67% of respondents. Stakeholders, especially large companies and investors and SMEs and startups, rank this as a crucial challenge. In leading innovation regions, commercial players consider these barriers as crucial, ranking them as second most important, closely trailing the financial barrier. However, areas with emerging and moderate innovation levels do not perceive commercial and adoption barriers as critical, only ranking them 6. So we see a huge difference here. Interviews underscore a notable gap in the frameworks and procedures for effective innovation incorporation by hospitals and other end-user systems. And this has been identified by 80% of SMEs and startups. So in-house capabilities for commercialization pose a shared concern. And this with often having problems with scaling up their solutions and looking for pediatric-specific partners that are already limited in terms of collaboration. Moreover, there's issues with the procurement processes, and these are not well set up for pediatric innovations, and especially not for digital therapeutics. And this creates a key barrier for, let's say, a pediatric innovation type, which are the digital health therapeutics, which typically tend to be lower cost to develop, easier to try and scale up, but have limited reimbursement opportunities. So overall, there was a consensus that there is a need to standardize and harmonize the purchasing and adoption process across the EU, just so that we can get access to a larger market that is more similar to the US. And this need for being able to scale up solutions in a market that is small was consistently repeated by all respondents. So what can we do? We can establish relationship-building opportunities between stakeholders, aiming to bridge the existing gaps and knowledge on adoption and public procurement understanding. The creation of channels for solution co-design and validation with healthcare professionals can further streamline the incorporation of innovations. Training sessions on building successful business cases furthermore directly responds to de-risking pediatric innovations and stimulating adoption. So the human capital barrier also offered some interesting insights, and this ranked 4th on an ecosystem level. So a substantial difference arises here when comparing commercially oriented groups to research-oriented groups. Commercial stakeholders rank it practically the second least important, while research-oriented institutions rank it the third most important barrier. Moreover, lower innovation groups find human capital a greater burden, while emerging innovation groups rank it with emerging innovation groups ranking it significantly higher than leading innovation groups, as we can see here. There is almost a negative correlation between the level of the innovation group and the importance of human capital barriers. So what are the specific issues here? So there is, on the first hand, a challenge in attracting and retaining the required talent for public organizations and lower innovation regions. So limited positions are dedicated to the innovation activities, and these limited positions are observed both in public institutions and emerging and moderate innovation countries. Moreover, there's a lack of collaboration-ready hospital infrastructure, as we can see here. Moreover, there's a scarcity of pediatricians in general, contributing to this challenge. So 80% of interviewees express a lack of human capital with the required skill sets, whether that be administrative aspects or entrepreneurial skills, primarily in soft skills like idea generation, risk-taking, and networking. So to address these challenges, strategic recommendations arise. So we can create training modules for commercial-oriented and soft skills that can bridge the gap in identified, attracting and retaining top talent. Moreover, including innovation subjects in education courses can contribute to building the necessary skill sets from an early stage. At the same time, dedicated hours for innovation activities within hospital systems and other institutions can let's say, ideate the solutions from the people who see the needs on a day-to-day basis. Challenges for public engagement, creating challenges for public engagement and having European innovation challenges can really raise awareness on the needs and the skill gaps that we need to overcome. So while cultural and incentive barriers, interestingly, were not a huge barrier, it differed per stakeholder group. So what we saw was that these were quite critical for research institutions and healthcare providers, and this links a little bit to the human capital barriers we saw before. So research-oriented stakeholders ranked this barrier as significantly more important than commercial counterparts. And 80% of interviews revealed that priorities within research-oriented institutions differ significantly amongst personnel, with a lack of motivation from management personnel. So interestingly, large companies from emerging innovators emphasize cultural barriers significantly. And this contrasted with large companies and moderate innovation companies, which ranked these barriers as the lowest. However, there was a unanimous concern amongst interviewees on the reliance of government funding for research-oriented institutions on outdated metrics rather than on innovation levels. So typically we see that the budget that gets allocated to hospital systems is not yet dependent on innovation metrics. And therefore there's a misalignment on the incentives from the top down. So this highlights a critical cultural and incentive barrier. So we need to find a way to reward this innovation amongst all stakeholders so that there's motive. And it should go beyond just the financial one. And as I mentioned before, while those directly involved in pediatric research often recognize the need, whether this is in clinicians or research institutions, senior staff or departments are often not motivated in the same manner nor held accountable. So overall, there needs to be a change in the workflows, there needs to be a change in the positions, there needs to be a change in the way that the innovation is measured and valued by the people that are working on it on day-to-day and also from the governmental side. So how can I4Kids Europe help overall? How can we try to make the biggest impact? So we can create widespread awareness about the imperative need for pediatric innovation across all stakeholders and innovation groups. We can organize comprehensive trainings and workshops that can play a pivotal role in bridging skill gaps and fostering collaboration, thereby creating essential alignment within the pediatric innovation landscape, whether it be on accessing calls, making sure that you're developing the right solution for the problem that the hospitals are actually facing, and creating best practices to avoid duplications. And finally, at the end of all of these 2 years, we will be developing a white paper of best practices for sustainable innovation in pediatric healthcare. Together, these initiatives can help overcome the barriers facing stakeholders and innovation groups across the pediatric ecosystem and contribute significantly to catalyzing positive change for younger generations across all innovation groups. Thank you.
Thank you for this amazing speech. Is it available already? The research, is it available in some PDF form maybe? Can you download it, for example, for the viewers, or it will be available?
So we have submitted it in the portal of the Commission, and we will make it available in the IPRK's website in a 4-week wait.
So it's going to be available in the following weeks. That's really amazing. And perfect. Thanks a lot. And we have a question. I don't know if you can have. Paulina, can we have questions? Paulina says yes. Okay, so we're going to have a question from Dr. Migdał.
My name is Marek Migdał. I am a pediatrician from Children's Memorial Health Institute in Warsaw. Congratulations for this fantastic presentation, very with conclusions, very useful for our future, I hope near future. But I get one question on the methodology of this survey, because I was surprised to see in the beginning of your presentation that the showing the results divided into 4 groups: leaders, and Poland is in this emerging group. And I was thinking that we get in our country a lot of problems related to the regulatory barriers. But in fact, in this category, there's no difference between leaders and emerging countries. It's a 0.2 score in this scale. Is it significant or is not?
So,
because it's 5.8 for the leaders and 6 for emerging countries.
So unfortunately, we didn't have sufficient responses to the questionnaire to properly assess significant differences. So if anyone here hasn't filled it out yet, the questionnaire is still open and you can give your input. But what I think, so in reality, it's true that the 0.2 difference is not per se significant, but what we did understand is that emerging and moderate innovation groups, they have a greater challenge in navigating this landscape. So as we all know, regulatory and reimbursement processes are super complex, very lengthy, and I think that most likely in leading and strong innovation countries, there's better support systems to help researchers or startups navigate these things. I think probably the frameworks are not that different because we operate at quite similarly to some extent in Europe. But yeah, so it would be great if we can get more responses so we can see whether this is indeed a significant difference. Yeah.
Thank you very much. Somewhere at the beginning of your presentation, I realized I was one of the interviewers, you know, so I was looking for myself, like, is there my quote somewhere there? I'm not sure because it was anonymized, but I kind of identified, like, number 3 looked familiar, 25 and 17, which means we all have similar problems, even though if you're in the leaders group or emerging group. So thanks again, that was amazing.